Hey guys, Dr. Childs here. Today we're going to be talking about whether or not you can use thyroid supplements to help you with weight loss. And we'll be talking about this in the context of those with hypothyroidism and then of course those who are just trying to lose weight and they're looking for other things. So we'll get into that in just a second. If you don't know me, I'm Dr. Childs. I'm an internist and I specialize in helping people treat thyroid problems, helping people with other hormone imbalances, and of course helping people with weight loss. So we're kind of talking about a combination of these things today. So let's get out the whiteboard so we can talk about this. So first of all, the topic today, like I said, is going to be thyroid supplements and weight loss. Oh, and by the way, if you haven't already, make sure that you hit the subscribe and the notification bell and so on. If you like this sort of information, I think you'll like future videos and past videos actually that I've done as well. So let's answer the question, do supplements work for weight loss, okay? Or can you use them in that way to help you lose weight? So there's really two groups of people that I've identified here that probably are asking this question. And the first would be those without thyroid problems, okay? So we'll just put no thyroid here, or no thyroid problems. And so what I mean by this is those people who, have a little bit of extra weight on their body, who are interested in losing weight, but don't have any known thyroid problems. So you might ask yourself, well, why would they want to use thyroid supplements? Well, that's actually a good idea. In fact, they might have gotten to this conclusion in a roundabout way. But if you know anything about the thyroid, you know it's responsible primarily for maintaining your metabolism, right? And your metabolism is the thing that helps you burn calories on a day-to-day basis. So the logic goes, if you can improve your thyroid, perhaps you can improve your metabolism, and through that process, you can then, of course, lose weight, right? So it's kind of an interesting way to go about this problem of weight loss by impacting, certain physiology in your body. And we'll talk about why that's probably may or may not be helpful in just a second. The second group of people would be those with thyroid problems. Okay, so that's probably the majority of you listening to this. So that would be those people who have known hypothyroidism, known Hashimoto's, those people who have had their thyroid removed, those people who have had their thyroid ablated. These people all already have thyroid problems. And these people, by virtue of their thyroid problems, also tend to suffer a lot from weight gain. Okay, so I would say probably 98% of people with thyroid problems, at least those people who I talk to, I mean, this is a biased sampling, obviously, but those people who I am talking to suffer from weight gain and extra weight on their body, and also the inability to lose weight. And as I just mentioned, it's because of the impact that the thyroid has on your metabolism and on your body. If your thyroid is low, guess what it's going to do to your metabolism? It's going to drive it down. That means that without doing anything to your body, let's say your metabolism is 15 or 20% less than it should be on a day-to-day basis. If we use just a normal 2,000, or standard 2,000 calories per day, that means that you might be burning anywhere from 300 to 400 fewer calories than your body would like to normally, just because your thyroid is sluggish, okay? So this is a problem for thyroid patients, and this is why I think a lot of them go to thyroid supplements to try and help with weight loss, because they want to boost up that thyroid, which boosts up that metabolism, which then helps you with weight loss. Okay, so let's talk about that. Now, boosting your thyroid is probably not the best way to go about this. We're going to talk about those supplements to avoid and what to look for in supplements for weight loss. But first I want to focus on really what you should be thinking about when you want to lose weight. And that is your T3 level. So here I have put that T3 is king when it comes to weight loss. Okay, and frankly, T3 is king when it comes to just feeling better and making sure that your thyroid is optimized. T3 is the active thyroid hormone in your body. Okay, it's about 200 to 300 times more powerful than T4, which many of you probably already know this, but I'll just say this, that T4 is the thing found in levothyroxine and Synthroid. Okay, so T3 is not included in this thyroid medication, which means that you have to take that thyroid medication and convert it to be active, which is why T3 is king in terms of maintaining your weight and managing your metabolism and so on. It has to be in a sufficient level if you want any hope of losing weight. So any therapy that you do should be focused on helping your body increase the amount of T3 that it has, okay? It can do that. And by the way, if you haven't already, I have a video that I talked about high levels of reverse T3. So if you have high levels of reverse T3, you're going to have low levels of T3, and a lot of these people also suffer from weight gain. So I have a whole video that describes what causes this condition to occur and what things to look out for. And by the way, those are the same things that we're going to be talking about here, but just in reverse, obviously, because if you can enhance these things, you'll increase T3. In the other video, I was talking about what you want to avoid to make sure that you don't have high reverse T3. But let's go back to T3 for a second. So why does it matter? Well, I said the higher your T3 is, the more likely or the higher your metabolism is going to be. So high T3 levels are associated with high metabolism. And we know from studies, in fact, I've looked at these, they're brand new, I'm brand new-ish, within the last couple of years, they showed a direct correlation between those people's, between thyroid patients' ability to lose weight and their T3 and T4 levels. So the higher these levels were, the more likely they were to be able to lose weight and keep it off because of these reasons we're talking about here. Predominantly, at least in the first section, we're talking about metabolism here. The next thing is that, of course, it's going to increase thyroid function. So that's going to reduce the symptoms of hypothyroidism. It's going to make you feel better. May help you with hair growth and so on. But it does this because this is T3 again is the main thyroid hormone, or it has all the activity in your body. Another thing is that it's going to increase your energy. So if you have high T3 levels, you'll have more energy. You'll be able to go work out. You'll feel like you can. You'll be more active throughout the day. You'll be able to get up and move around and walk around. And many of you listening to this probably don't feel that way right now because, again, you're probably on these medications and have these other issues. And if you have low energy, it's going to be really difficult to do your workout, to want to move around. That's going to, that lifestyle is going to drop your metabolism even further, right? The next thing is it's going to increase heat and it's going to increase your heart rate. So don't worry about heart. It's not going to elevate your heart rate to, beyond what it should be normally. In fact, many of you probably listening to this probably have a heart rate in the 50 to 60 range. And unless you're a conditioned athlete, that's not normal. Okay, that's probably, secondary to your thyroid problem that's going on. So you want to increase this T3 to help with weight loss. Again, we're going to talk about how to do that in just a second, but I want to talk about first those things that you want to definitely be avoiding if you have thyroid problems. Okay, so the first thing in here, so a lot of people, as I said before, if they have thyroid problems, they suffer from weight gain, so they're thinking, what can I do to lose weight? Their first thought probably goes to dieting, okay? Then their second thought goes to, well, let's use some supplements to augment this process. But they're not thinking about it in this way. All of this stuff I just talked about, that's not how it's going through their mind. Instead, they're probably looking at these sort of supplements which are already available. So the first thing that you want to avoid is anything that sounds too good to be true or sounds a little gimmicky, okay? So if you're there's a lot of marketing schemes out there. They'll say, you can lose 5 to 10 pounds in a week or two. That's obviously not true, especially if you have thyroid. That's just not the way that your body loses weight and the way that it works. I just described the physiology here. So anything that's gimmicky or sounds too good to be true, definitely avoid it. Again, we'll talk about what to look for in just a second here. The next one on here, I put raspberry ketones. Again, it's not really a gimmicky thing. It just doesn't really work that well, so I don't think they're very effective. Orlistat is another one. So orlistat is something that blocks your body's ability to absorb fat. Okay, there have been some studies. I think you used to be able to buy this at Costco. I don't even think it's there anymore, but it's still available on Amazon and things like that. It comes from the idea that fat is the thing that makes us gain weight, and so if you block the fat absorption, you can eat all the fat you want, and then you'll just eliminate it through your stool. Again, doesn't really work out that way. Another one is Garcinia cambogia. So some people use it and they've had success, but it's sort of marketed as a weight loss medicine, or at least it's included in a lot of weight loss supplements. Again, it's not going to really be beneficial. And then, of course, hydroxycut. That's another one. That one's fallen out of favor, I think, somewhat recently, but it's still out there, included in this list of weight loss supplements. So what do you actually want to look for? By the way, make sure you just don't use those. They're just not going to be effective. But let's talk about what you should be using. So any supplement which is going to increase your T3 levels, obviously, is going to be something that's helpful. And so this is why I'm talking about, I kept mentioning before that video that I did on T4 to T3 conversion and T4 to reverse T3 conversion. The higher your reverse T3 is, the more difficult it is for you to lose weight because your body's not activating that thyroid hormone correctly. So you want to do these therapies which increase T3 levels. And a lot of the things that we're going to be talking about below here, they do that sort of automatically. Okay, so one example would be, just to put this into perspective, is anything that reduces inflammation. So you might not be thinking about supplements which reduce inflammation as those things which can help with weight loss, but it actually is true. And I'm going to give you one example here, and that is fish oil. So fish oil, believe it or not, is actually, in my opinion, a pretty good weight loss medicine, or supplement, I should say. It's not really a medicine. But those people, and I use it as part of my weight loss programs that I give out to patients, because it's quite effective, right? It's dropping that inflammation, which is, what is that doing to your thyroid? It's actually improving it, because it's improving T4 to T3 conversion. And we have studies that show that it can help with insulin resistance. It can actually increase the amount of muscle mass you have while driving down fat mass. It's just a really, really all-around good weight loss. I'm air quoting here because it's not really, people don't think of it as a weight loss supplement, but by virtue of its ability to impact and reduce inflammation, it can actually have a positive effect on that. So anything that reduces inflammation may help your thyroid by increasing T3, which then increases metabolism, which then leads to the weight loss that we're talking about. Another thing would be anything which normalizes your appetite. So remember, I'm being very specific here in my language. I'm talking about normalization of your appetite. So that's a reduction in unhealthy food cravings, okay? It doesn't mean that you're reducing your calories. That is not a good thing. That's not a recipe, or that's a recipe for disaster if you consistently reduce your calories. And what you'll notice is a lot of these up here, they do have an element of appetite suppression. Not all of them, but Garcinia cambogia, hydroxycut, and maybe the raspberry ketones to some degree. But these things help reduce your appetite, which isn't always a good thing. You don't want to just reduce it and eat fewer calories each day. What you want to do is normalize that appetite. You want to get rid of those cravings that you have for unhealthy foods, for sugary and starchy foods and pastries and all those things, and things that have inflammatory industrial seed oils. You want to eliminate those things and eat only healthy things. And certain supplements can actually help the normalization of your appetite by impacting your hormones, okay? Another one would be something that actually, you know what, we'll talk about a couple other here, because as I'm talking, I'm thinking of other things, and then here we'll add a couple others here. But protein powders would be another good thing, another potential way to help you with weight loss in an indirect way. You probably don't think about protein powders as a weight loss supplement, but they can actually be effective because they're helping your body increase muscle mass, which is increasing metabolism, all right? And it's also one of those things that can actually normalize your appetite, because protein causes satiety. Okay, and satiety makes it so you feel full and you don't have those cravings. So don't neglect protein powder. If you are a thyroid patient, make sure that it's plant-based. That's my recommendation. Whey protein still is derived from some dairy products, and so it can be a little bit inflammatory to thyroid patients. So make sure you're getting a good protein powder. And I have some list of some supplements. You can see mine, which fall into some of these categories below if you want to check those out. Again, anything that promotes T4 to T3 conversion, kind of talked about that with one up here with increasing T3 levels. And then the two that I added would be anything that targets leptin or insulin resistance. Okay, so that would be things like, there's a lot of supplements which can help with insulin resistance, fewer that help with leptin. But these are hormones which alter how your body's ability, let's say, to burn fat as a fuel source. So if you have leptin resistance or insulin resistance, those things will impede your ability to lose weight. And you can take certain supplements to help treat those problems. And then the last one would be anything which improves your gut. So from the perspective of a thyroid patient, a lot of your thyroid conversion occurs in your gastrointestinal tract. So if you have problems in your gut, that's going to limit your T3 levels in an indirect way. So you can use these things to help you with weight loss. So I know what you're probably thinking. These may not be, quite the way that you're normally thinking about this process, but I would encourage you to think about it in this way, because it actually will help you get better results in the long term. Avoid this sort of mentality where you look for supplements which target weight loss, or they fall into the category of weight loss supplements. Instead, look for things which are targeted to your body and the imbalances that you suffer from, and those things will help bring your T3 up, reduce inflammation in your body, normalize hormone levels such as leptin and insulin and so on, and that's really how you get long-lasting weight loss. So if you have used any of these supplements, and I want to talk about, even these ones up here, the ones that I'm calling, quote unquote gimmicky here. But if you've also used these, leave it in the comments below. I want to hear about it. Give me your experience. What you'll probably find, and you'll probably see this in the comments if enough people leave them, is that once you start using these supplements, you will have a little bit of a success. So someone could use, let's say, raspberry keto, well, let's just say Garcinia cambogia. Let's say they use that for a couple weeks, they lose 5 pounds, and they're like, yeah, this is working, this is feeling great. But guess what's going to happen? In about 2 months or whatever, once they stop taking it, guess what? All that weight's going to come back. But if you do it this way, so there's some temporary weight loss potentially with some of these, but these will lead to long-lasting and sustained weight loss. So again, I want to hear if you've used these ones up here, or if you've tried the different way or the different approach that I've outlined below, and let me know if those work for you below in the comment section. Also, I will go ahead and leave a link to some of the supplements that I recommend which fall into these categories, so you can find that below in the comment section or the description, so you can see kind of what I'm talking about here. And if you haven't already, don't forget to download my free thyroid resources. I have a full list of, I think there's 8 different downloadable PDF resources that you can use, all designed to help you feel better, foods to avoid if you have thyroid problems, optimal lab tests, I give you the full list, how to work with your doctor, and so on. So make sure that you go and download those if you haven't already. And otherwise, I'll see you guys in the next one.